You might not know your blood sugar is off until you feel tired all the time, thirsty most of the day, or notice your vision getting blurry. Many people live with higher blood sugar for months or years without realizing it. Today we'll cover what blood sugar is, why it matters for your body, common signs that may appear when it's too high or too low, why regular testing is important, risk factors for high blood sugar, lifestyle habits that may support healthy blood sugar, what to do if you're concerned, and when to see your clinician. This guide is designed for general adults, caregivers, and anyone curious about blood sugar awareness. This content is for educational and informational purposes only, and is not medical advice. Always consult a qualified healthcare professional regarding health concerns. Let's break down what blood sugar actually is. Blood sugar, also called glucose, is the main energy source for your body's cells and organs. When you eat food, especially carbohydrates like bread, pasta, rice, fruit, or sweets, your digestive system breaks them down into glucose. This glucose enters your bloodstream and travels to all your cells. But glucose needs help getting inside your cells. That's where insulin comes in. Insulin is a hormone made by your pancreas. It helps carry glucose into your cells to be used for energy. When this system works well, your blood sugar stays in a healthy range. When it doesn't work well, blood sugar can become higher or lower than normal. Think about this. Understanding how your body uses energy helps you make better choices for your health. Understanding what blood sugar is helps you recognize warning signs and take thoughtful steps for prevention. Here's what to watch for. Signs that blood sugar may be higher than normal include feeling very thirsty, needing to pee more often than usual, feeling tired or fatigued, blurred vision, headaches, feeling hungrier than normal, or slow healing of cuts or sores. These signs can happen over time as blood sugar stays elevated. Signs that blood sugar may be lower than normal include feeling shaky, sweating, feeling anxious or irritable, having a fast heartbeat, feeling dizzy, feeling confused, or having trouble concentrating. These symptoms can happen quickly. Other signs that may appear include unexplained weight loss, frequent infections, tingling or numbness in hands or feet, or dark patches of skin on your neck or underarms. If you felt some of these symptoms, you'd want to know what to do. These signs can have other causes, but if they happen consistently, they may suggest blood sugar changes. If you notice these signs consistently, talk with your clinician. Over time, consistently higher blood sugar may affect blood vessels, nerves, and organs. This may increase risk for heart disease, stroke, kidney disease, eye changes, nerve changes, or foot problems. That's why understanding your blood sugar and getting regular testing is important. Regular monitoring can help you catch changes early and take steps to support your health. Even if you feel fine, you might still have blood sugar changes. Many people don't find out they have higher blood sugar until their regular checkup.
Here's why some people develop higher blood sugar and others don't. Some risk factors can't be changed, like age, family history, and certain ethnicities. Risk may increase with older age, family history of diabetes, and being of certain ethnic backgrounds such as African American, Hispanic or Latino, Native American, Asian American, or Pacific Islander. Other risk factors can be managed. These include being overweight or having obesity, physical inactivity, eating a diet high in processed foods and added sugars, high blood pressure, high cholesterol, history of gestational diabetes, having polycystic ovary syndrome, smoking, and poor sleep quality or sleep apnea. Prediabetes is another risk factor. This is when blood sugar is higher than normal but not high enough to be diagnosed as diabetes. How many of these risk factors do you have? Managing these factors may help support healthy blood sugar over time. Regular checkups and monitoring are important, especially if you have multiple risk factors. Blood sugar testing is simple and can be done in a few minutes. There are several common tests. A fasting plasma glucose test measures your blood sugar after you haven't eaten for at least 8 hours. An A1C test measures your average blood sugar over the past 2 to 3 months. An oral glucose tolerance test measures your blood sugar before and 2 hours after drinking a sugary drink. A random plasma glucose test measures your blood sugar at any time, regardless of when you last ate. Your clinician can help you choose the right test and understand your results. Ranges may vary depending on the test and your health status. When was your last blood sugar test? If you're concerned about your blood sugar, ask your clinician about which test is right for you. Early identification and management may help support long-term health. Small daily choices can support your blood sugar for years. Some people find these habits supportive for healthy blood sugar. Eat a balanced diet rich in vegetables, fruits, whole grains, legumes, and lean proteins. Limit processed foods, added sugars, sugary drinks, and refined carbohydrates. Stay physically active with regular movement like walking, cycling, or swimming. Maintain a healthy weight. Avoid smoking and limit alcohol. Manage stress through relaxation, sleep, and social connection, and get regular checkups. Which one habit could you start this week? Small, consistent habits often support general wellness over time. Talk with a healthcare professional before making major changes, especially if you have existing health conditions or are on medications. Diet plays a role in blood sugar management. Focus on whole foods like vegetables, fruits, whole grains, legumes, nuts, and lean proteins. Limit processed foods, sugary drinks, white bread, white rice, and sweets. Choose complex carbohydrates over simple carbohydrates. Pair carbohydrates with protein or healthy fats. Stay hydrated with water instead of sugary drinks. What's one healthy swap you could make at your next meal? If you have concerns about blood sugar, ask your clinician or a registered dietitian about meal planning. Balanced eating with appropriate portions may help support healthy blood sugar levels.
Moving may help support healthy blood sugar. Aim for 150 minutes of moderate activity weekly, walking, cycling, or swimming. Add strength training twice per week. Exercise helps muscles use glucose and may support insulin function. Start slow if new to exercise. Move after meals. Take stairs. Find activities you enjoy. What activity could you do today? If you have health conditions, check with a healthcare professional first. Smoking may affect insulin function. Quitting may help support health. Support from clinicians or counseling may help. Alcohol in excess may affect blood sugar. Limit to moderate levels. What's one small step this week? If struggling, talk with a healthcare professional. Stress can raise blood sugar temporarily. Chronic stress may affect it over time. Managing stress through breathing, meditation, yoga, or nature may help. Quality sleep matters. Poor sleep may affect blood sugar. Aim for 7 to 9 hours nightly. What technique could you try this week? If you have stress or sleep problems, talk with your clinician. Management varies. Some use lifestyle changes, others may need medications, oral or injectable. Your clinician helps choose the plan. Home monitoring may be recommended. Continuous glucose monitors may help track levels. Support from clinicians, dietitians, and educators may help. Family support is important. Progress happens over months or years. Every step counts. Celebrate small wins. If blood sugar was higher than normal, schedule a clinician appointment. Share symptoms, risk factors, and family history. Ask about fasting glucose or A1C tests. Review medications and habits. If told you may have prediabetes or diabetes, ask about your personalized plan. Keep a health log with dates, results, readings, and symptoms. Bring it to appointments. What's one action today? If concerned, check blood sugar if recommended. Ask about A1C and fasting glucose tests. Share risk factors. Review medications. Track health. Keep a log. If you have risk factors, ask about your management plan. For reliable info, American Diabetes Association, CDC Diabetes, National Institute of Diabetes, World Health Organization, or local health services. Support groups and education programs help with practical questions. Subscribe for more clear, evidence-aligned health education. Share with a family member, friend, or caregiver. Your body needs balanced blood sugar for energy. Understanding warning signs and management helps you take informed steps. This content is for educational and informational purposes only, and is not medical advice. Always consult a qualified healthcare professional regarding health concerns.